Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Osimertinib, after chemoradiotherapy in Stage 3 EGFR-Mutated NSCLC. Background. Osimertinib is a recommended treatment for advanced non-small cell lung cancer, NSCLC, with an epidermal growth factor receptor, EGFR, mutation, and as adjuvant treatment for resected EGFR-mutated NSCLC. EGFR tyrosine kinase inhibitors have shown preliminary efficacy in unresectable Stage 3 EGFR-mutated NSCLC. Methods. In this Phase 3, double-blind, placebo-controlled trial, we randomly assigned patients with unresectable EGFR-mutated Stage 3 NSCLC without progression during or after chemoradiotherapy to receive osimertinib or placebo until disease progression occurred, as assessed by blinded independent central review, or the regimen was discontinued. The primary endpoint was progression-free survival, as assessed by blinded independent central review. Results. A total of 216 patients who had undergone chemoradiotherapy were randomly assigned to receive osimertinib, 143 patients, or placebo, 73 patients. Osimertinib resulted in a significant progression-free survival benefit as compared with placebo. The median progression-free survival was 39.1 months with osimertinib versus 5.6 months with placebo, with a hazard ratio for disease progression or death of 0.16, 95% confidence interval, CI, 0.10 to 0.24, p less than 0.001. The percentage of patients who were alive and progression-free at 12 months was 74%, 95% CI, 65 to 80, with osimertinib and 22%, 95% CI, 13 to 32, with placebo. Interim overall survival data, maturity, 20%, showed 36-month overall survival among 84% of patients with osimertinib, 95% CI, 75 to 89, and 74% with placebo, 95% CI, 57 to 85, with a hazard ratio for death of 0.81, 95% CI, 0.42 to 1.56, p equals 0.53. The incidence of adverse events of grade 3 or higher was 35% in the osimertinib group and 12% in the placebo group. Radiation pneumonitis, majority grade 1 to 2, was reported in 48% and 38%, respectively. No new safety concerns emerged. Conclusions. Treatment with osimertinib resulted in significantly longer progression-free survival than placebo in patients with unresectable Stage 3 EGFR-mutated NSCLC. Cognitive motor dissociation in disorders of consciousness. Background. Patients with brain injury who are unresponsive to commands may perform cognitive tasks that are detected on functional magnetic resonance imaging, fMRI, and electroencephalography, EEG. This phenomenon, known as cognitive motor dissociation, has not been systematically studied in a large cohort of persons with disorders of consciousness. Methods. In this prospective cohort study conducted at 6 international centers, we collected clinical, behavioral, and task-based fMRI and EEG data from a convenient sample of 353 adults with disorders of consciousness. We assessed the response to commands on task-based fMRI or EEG in participants without an observable response to verbal commands, i.e., those with a behavioral diagnosis of coma, vegetative state, or minimally conscious state minus, and in participants with an observable response to verbal commands. The presence or absence of an observable response to commands was assessed with the use of the Coma Recovery Scale revised, CRSR. Results. Data from fMRI only or EG only were available for 65% of the participants, and data from both fMRI and EEG were available for 35%. The median age of the participants was 37.9 years. The median time between brain injury and assessment with the CRSR was 7.9 months. 25% of the participants were assessed with the CRSR within 28 days after injury, and brain trauma was an etiologic factor in 50%. We detected cognitive motor dissociation in 60 of the 241 participants, 25%, without an observable response to commands, of whom 11 had been assessed with the use of fMRI only, 13 with the use of EEG only, and 36 with the use of both techniques. Cognitive motor dissociation was associated with younger age, longer time since injury, and brain trauma as an etiologic factor. In contrast, responses on task-based fMRI or EEG occurred in 43 of 112 participants, 38%, with an observable response to verbal commands. Conclusions. An accurate and rapidly calibrating speech neuroprosthesis. Background. Brain-computer interfaces can enable communication for people with paralysis by transforming cortical activity associated with attempted speech into text on a computer screen. Communication with brain-computer interfaces has been restricted by extensive training requirements and limited accuracy. Methods. A 45-year-old man with amyotrophic lateral sclerosis, ALS, with tetraparesis and severe dysarthria, underwent surgical implantation of 4 microelectrode arrays into his left ventral precentral gyrus 5 years after the onset of the illness. These arrays recorded neural activity from 256 intracortical electrodes. We report the results of decoding his cortical neural activity as he attempted to speak in both prompted and unstructured conversational contexts. Decoded words were displayed on a screen and then vocalized with the use of text-to-speech software designed to sound like his pre-ALS voice. Results. On the first day of use, 25 days after surgery, the neuroprosthesis achieved 99.6% accuracy with a 50-word vocabulary. Calibration of the neuroprosthesis required 30 minutes of cortical recordings, while the participant attempted to speak, followed by subsequent processing. On the second day, after 1.4 additional hours of system training, the neuroprosthesis achieved 90.2% accuracy, using a 125,000-word vocabulary. With further training data, the neuroprosthesis sustained 97.5% accuracy over a period of 8.4 months after surgical implantation, and the participant used it to communicate in self-paced conversations at a rate of approximately 32 words per minute for more than 248 cumulative hours. Conclusions. In a person with ALS and severe dysarthria, an intracortical speech neuroprosthesis reached a level of performance suitable to restore conversational communication after brief training. Next, we will be discussing articles from Journal of American Medical Association. Uterus transplant in women with absolute uterine factor infertility. Is uterus transplant safe and feasible, resulting in subsequent live births? Findings. In this series of 20 participants, uterus allograft was successful in 70% of recipients and was associated with at least one live birth for all recipients with a successful allograft. Adverse events were common, with medical and surgical risks affecting recipients as well as donors, meaning uterus transplant was feasible and was associated with at least one subsequent live birth following a successful allograft. Edetate disodium-based chelation for patients with a previous myocardial infarction and diabetes. TAT2, randomized clinical trial. Question: does therapy with edetate disodium, EDTA, base chelation reduce major adverse cardiovascular events compared with placebo infusions among patients with diabetes and prior myocardial infarction, MI? Findings: EDTA-based chelation did not reduce major adverse cardiovascular events compared with placebo infusion, with a hazard ratio of 0.93, 95% CI, 0.76 to 1.16, p equals 0.53. Chelation infusions did reduce the median blood levels from 9.0 G/L at baseline to 3.5 G/L at infusion 40, p less than 0.001, meaning among patients with diabetes and prior MI, EDTA-based chelation decreased median blood lev levels by 61% from baseline, but did not reduce major adverse cardiovascular events. Next, we will be discussing articles from Annals of Internal Medicine. Differentiation of prior SARS-CoV-2 infection and postacute sequelae by standard clinical laboratory measurements in the RECOVER cohort. Background. There are currently no validated clinical biomarkers of postacute sequelae of SARS-CoV-2 infection, PASC. Objective: to investigate clinical laboratory markers of SARS-CoV-2 and PASC. Results: among 10,094 participants, 8,746 had prior SARS-CoV-2 infection, 1,348 were uninfected, 1,880 had a PASC index of 12 or higher, and 3,351 had a PASC index of 0. After propensity score adjustment, participants with prior infection had a lower mean platelet count, 265.9 times 109 cells/L, 95% CI, 264.5 to 267.4 times 109 cells/L, than participants without known prior infection, 275.2 times 109 cells/L, CI, 268.5 to 282.0 times 109 cells/L, as well as higher mean hemoglobin A1c, HbA1c, level, 5.58%, CI, 5.56% to 5.60%, versus 5.46%, CI, 5.40% to 5.51%, and urinary albumin-creatinine ratio, 81.9 mg/g, CI, 67.5 to 96.2 mg/g, versus 43.0 mg/g, CI, 25.4 to 60.6 mg/g, although differences were of modest clinical significance. The difference in HbA1c levels was attenuated after participants with pre-existing diabetes were excluded. Among participants with prior infection, no meaningful differences in mean laboratory values were found between those with a PASC index of 12 or higher and those with a PASC index of 0. Conclusion: overall, no evidence was found that any of the 25 routine clinical laboratory values assessed in this study could serve as a clinically useful biomarker of PASC. Next, we will be discussing articles from British Medical Journal. Decompression alone, or with fusion for degenerative lumbar spondylolisthesis. Objective: to assess whether decompression alone is non-inferior to decompression with instrumented fusion 5 years after primary surgery in patients with degenerative lumbar spondylolisthesis. Conclusions: in participants with degenerative spondylolisthesis, decompression alone was non-inferior to decompression with instrumented fusion 5 years after primary surgery. Proportions of subsequent surgeries at the index level, or an adjacent lumbar level, were no different between the groups. Interventions: decompression surgery alone and decompression with additional instrumented fusion, 1:1. Next, we will be discussing articles from Lancet. Safety and efficacy of subcutaneous iscalimab, CFC 533, in 2 distinct populations of patients with Sjögren's disease. Background: Sjögren's disease is a chronic autoimmune disease with an unmet need for targeted therapies. The aim of the TWINT study is to evaluate the safety and efficacy of iscalimab, a monoclonal antibody against CD40, in patients with active Sjögren's disease. Findings: between October 1, 2019, and February 28, 2022, 460 patients were screened. 173 patients were assigned to Cohort 1, 44 to iscalimab 150 mg, 43 to 300 mg, 43 to 600 mg, and 43 to placebo, and 100 to Cohort 2, 50 to each group. In Cohort 1, The MCP step showed a significant dose-response relationship for placebo-adjusted ASTI change from baseline in one of 4 models. Linlog model, one-sided p equals 0.0041. ASTI decreased from baseline to week 24, with all 3 doses of iscalimab, 150 mg and 600 mg doses, showed statistically significant improvement. Placebo-adjusted least squares, LS, mean difference, 3 middle.0, 95%, CI4 middle.9 to 1 middle.1. P equals 0.0025 for 112, 50 mg and 2 middle.9, 4 middle.9 to 1 middle.0. P equals 0.0037 for 600 mg. In Cohort 2, Esprit showed a trend towards improvement with iscalimab 600 mg. Placebo-adjusted LS mean change from baseline 0.57 points, 95% CI 1.30 to 0.15, P equals 0.12. Serious adverse events were reported in 9 patients in Cohort 1, 2% of 43 in the placebo group, 2% of 44 in the iscalimab 150 mg group, 7% of 42 in the 300 mg group, 9% of 44 in the 600 mg group, and 4 patients in Cohort 2, 4% of 50 in each group. No deaths occurred over the 24-week period. Interpretation. The study met the primary objective of demonstrating a significant dose-response relationship with iscalimab in terms of disease activity at week 24. Iscalimab was well tolerated and showed initial clinical benefit over placebo in 2 distinct populations of patients with Sjögren's disease, to be confirmed in larger trials. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Phase 2, Efficacy and Safety of 80 mg, Osimertinib in patients with Leptomeningeal Metastases, associated with epidermal growth factor receptor mutation positive non-small cell lung cancer, Blossom purpose. Leptomeningeal metastases, LMs, exhibit a high incidence in patients with epidermal growth factor receptor, EGFR-mutated non-small cell lung cancer, NSCLC, post-treatment with first or second-generation EGFR tyrosine kinase inhibitors, TKIs. This investigation evaluates the efficacy, safety, and pharmacokinetics of 80 mg once-daily osimertinib in patients with LMs resistant to prior first or second-generation EGFR TKIs. Materials and methods. In this Phase 2 multicenter, open-label, single-arm study, 80 mg osimertinib was administered to patients with EGFR-mutated NSCLC who had developed LMs subsequent to treatment with prior EGFR TKIs. The primary endpoint was overall survival, OS, assessed alongside objective response rate by the Blinded Independent Central Review, BICR, and a pharmacokinetic analysis of plasma and cerebrospinal fluid, CSF, on the first day of cycles 3 and 6. Results. A total of 73 patients diagnosed with LM were treated with osimertinib, including 64 patients evaluable for the LM efficacy set, T790M negative, N equals 62, and T790M positive, N equals 2. The median OS in the full analysis set was 15.6 months, 95% CI, 11.5 to 20.2. The objective response rate for LM was 51.6%, including a 15.6% complete response, and the disease control rate was 81.3% by BICR in the LM efficacy evaluable set. The median LM progression-free survival by BICR was 11.2 months, 95% CI, 7.7 to 15.3. The duration of response was 12.6 months, 95% CI, 7.6 to 17.7, and OS was 15.0 months, 95% CI, 11.3 to 18.7. Pharmacokinetic analysis showed that the CSF to free plasma osimertinib ratio was 22%. Most safety profiles were grade 1 and 2. Conclusion. The study demonstrates significant intracranial efficacy and survival benefits of 80 mg once daily osimertinib in NSCLC patients with LMs. The data support considering daily 80 mg of osimertinib as a treatment option for EGFR-mutated NSCLC patients with LMs, irrespective of T790M mutation status. Here are the articles from Journal of Hepatology ALT to QHBS. OG ratio predicts long-term HBs-AG seroclearance after entecavir cessation in Chinese patients with chronic hepatitis B. Predictors of HBs-AG seroclearance following finite nucleoside analog (NA) therapy have important clinical implications. The ALT/QHBs-AG ratio may reflect the balance between host control and virological activity after NA withdrawal. The ALT/QHBs-AG ratio from end of treatment up to week 48 predicted HBs-AG seroclearance after stopping entecavir. The ALT/QHBs-AG ratio had excellent diagnostic performance for predicting HBs-AG seroclearance. The predictive performance of the ALT/QHBs-AG ratio remained consistent, regardless of whether entecavir was resumed. Next one, FAN-mediated fatty acid biosynthesis remodels immune environment in Clonorchis sinensis infection-related intrahepatic cholangiocarcinoma. Overall survival and response to immunotherapy are significantly worse in C. sinensis infected patients with EGFR. The fatty acid biosynthesis pathway and FAN expression are significantly upregulated in C. sinensis-related EGFR. Metabolic changes in C. sinensis-related ICA induce macrophage TAM-like polarization and impaired T-cell cytotoxicity. FAN inhibitor treatment enhances anti-PD-1 efficacy in ICA mouse models treated with ESPs from C. sinensis. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Biopsy proteome scoring to determine mucosal remodeling in celiac disease. Background and aims. Histologic evaluation of gut biopsies is a cornerstone for diagnosis and management of celiac disease, said. Despite its wide use, the method depends on proper biopsy orientation, and it suffers from inter-observer variability. Biopsy proteome measurement reporting on the tissue state can be obtained by mass spectrometry analysis of formalin-fixed paraffin-embedded tissue. Here we aimed to transform biopsy proteome data into numerical scores that give observer-independent measures of mucosal remodeling in said methods. A pipeline using glass-mounted formalin-fixed paraffin-embedded sections for mass spectrometry-based proteome analysis was established. Proteome data were converted to numerical scores using two complementary approaches: a rank-based enrichment score, and a score based on machine learning using logistic regression. The two scoring approaches were compared with each other, and with histology analyzing 18 patients with SED with biopsies collected before and after treatment with a gluten-free diet, as well as biopsies from patients with SED with varying degree of remission, N equals 22. Biopsies from individuals without SED, N equals 32, were also analyzed. Results. The method yielded reliable proteome scoring of both unstained and H&E stained glass-mounted sections. The scores of the two approaches were highly correlated, reflecting that both approaches pick up proteome changes in the same biological pathways. The proteome scores correlated with villus height to crypt depth ratio. Thus, the method is able to score biopsies with poor orientation. Conclusions. Biopsy proteome scores give reliable observer and orientation independent measures of mucosal remodeling in SED. The proteomic method can readily be implemented by non-expert laboratories in parallel to histology assessment and easily scaled for clinical trial settings. Here are the articles from Clinical Gastroenterology. Efficacy of anti-obesity medications in patients with celiac disease on a gluten-free diet, a retrospective matched cohort study. Goals. We aim to describe the weight loss outcomes of patients with celiac disease, SED, taking anti-obesity medications, AMs, and compare it with the weight loss outcomes of patients without SED taking AMs. Background: increasing rates of obesity and obesity-associated comorbidities have been previously reported in patients with SED on a gluten-free diet. The effectiveness of AMs in this population has not been previously described. Methods: in our retrospective cohort study, we matched 39 patients with treated SED to 78 patients without SED based on sex and AM. We assessed the weight loss outcomes at 3, 6, and 12 months after starting the AM in both cohorts, and analyzed if there was a differential response when comparing by type of AM. Injectable glucagon-like peptide 1, GLP-1, receptor agonists versus oral non-GLP-1 AMs. Results: both cohorts had similar baseline demographic and anthropometric characteristics. At 12 months, the SED cohort had a non-significantly inferior total body weight loss percentage compared with the cohort without SED, 6.5% versus 9.5%, p equals 0.13. The SED cohort had a similar proportion of patients achieving a total body weight loss percentage of greater than or equal to 5% than the cohort without SED, 72.7% versus 72.1%, p equals 1.00. No significant difference was observed when comparing the weight loss outcomes of injectables, GLP-1 receptor agonists, to oral AMs. The proportion of patients reporting side effects was similar for both groups, regardless of the type of AM. Conclusion: patients with SED taking AMs had similar weight loss outcomes to patients without SED. Hence, AMs can be a safe and effective therapy for weight management in patients with SED. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. Treatment patterns for end-stage kidney failure in patients with systemic lupus erythematosus. Background: this study aims to examine the treatment patterns of end-stage kidney disease, ESKD, among SLE patients and to compare the outcome of hemodialysis, HD, and peritoneal dialysis, PD. Conclusions: Asian patients with ESKD were more likely to have PD as the first treatment. The optimal dialysis type for ESKD patients with SLE might be different from ESKD patients caused by other diseases. ESKD patients with SLE receiving PD first had superior outcomes than patients receiving HD first. Next, we will be discussing articles in the field of cardiology. Here are the articles from journals of the American College of Cardiology. Kidney and cardiovascular effectiveness of SGLT2 inhibitors versus GLP-1 receptor agonists in type 2 diabetes. Background: emerging data suggest that glucagon-like peptide 1 receptor agonists, GLP-1 RAs, improve kidney outcomes for people with type 2 diabetes, T2D. Direct comparisons of the kidney and cardiovascular effectiveness of GLP-1 RA with sodium glucose cotransporter 2 inhibitors, SGLT2I, a first-line therapy for this population, are needed. Objectives. Conclusions: SGLT2I and GLP-1 RAs led to similar kidney and cardiovascular outcomes in people with T2D, though SGLT2I initiation was associated with a lower risk of 40% EGFR decline. From JAMA Cardiology: Neighborhood Social Vulnerability and Premature Cardiovascular Disease in Haiti. Question: what is the association between neighborhood social vulnerability and cardiovascular disease in an urban setting in Haiti? Findings in this population-based cohort study of 2,925 residents in urban Haiti, among whom 70.2% reported living in extreme poverty, the prevalence of hypertension and heart failure was greatest in the individuals living in the most socially vulnerable neighborhoods. The association with living in the highest vulnerability neighborhoods was greatest in young adults and women, meaning in Haiti, the most impoverished country in the Western Hemisphere, Differences in poverty and social vulnerability were associated with a higher prevalence of hypertension and heart failure. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Ninaprativ, active surveillance of larger malignant and suspicious thyroid nodules. Context. Active surveillance for papillary thyroid cancer, PTC, meeting criteria for surgical resection is uncommon. Which patients may prove reasonable candidates for this approach is not well defined. Objective. This work aims to examine the feasibility and safety of active surveillance for patients with known or suspected intrathyroidal PTC up to 4 cm in diameter. Methods. A retrospective review was conducted of all consecutive patients who underwent non-operative active surveillance of suspicious or malignant thyroid nodules over a 20-year period from 2001 to 2021. Conclusion. These data expand consideration of active surveillance of PTC in select patients with intrathyroidal suspected malignancy greater than 1 cm in diameter. Rescue surgery, if required at a later time point, appears effective. Here are the articles from Diabetes Care. Determinants of Diabetes Awareness Among Hispanic/Latino Adults in the U.S., 2005 to 2018. Objective. Despite improvements in screening, Hispanic/Latino individuals bear a disproportionate burden of undiagnosed diabetes in the U.S. Identifying who is at risk within this large and diverse population is important for targeting interventions. In this study, we sought to characterize risk factors for undiagnosed diabetes among Hispanic/Latino adults. We also investigated determinants among insured adults to explore barriers for those with access to care. Research design and methods. We used data from 1,883 Hispanic/Latino adults aged greater than or equal to 20 years from the National Health and Nutrition Examination Surveys, 2005 to 2018. Sequential multivariable logistic regression models were used to examine a range of social, healthcare, and individual-level determinants of undiagnosed diabetes, defined as having elevated fasting plasma glucose greater than or equal to 126 mg/dl, or HbA1c greater than or equal to 6.5%, 48 millimoles per mole, in participants self-reporting as not having diabetes, in the overall sample and among those with health insurance, N equals 1,401. Results. Younger age, 20 to 44 years, male sex, and having immigrated, compared with being U.S.-born, but not socioeconomic factors, were significantly associated with a higher odds of undiagnosed diabetes, compared with being diagnosed. These estimates were attenuated after adjusting for healthcare utilization variables. In fully adjusted models, having no healthcare visits in the past year, reporting no family history of diabetes, and having better self-reported health, were the predominant risk factors for undiagnosed diabetes in the overall sample and among insured Hispanic/Latino adults. Conclusions. Our findings highlight the importance of reaching younger, male, and immigrant Hispanic/Latino adults and addressing barriers to healthcare utilization, even among insured adults, to improve diabetes awareness. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Associations of cerebral blood flow patterns with gray and white matter structure in patients with temporal lobe epilepsy. Background and objectives. Neuroimaging studies in patients with temporal lobe epilepsy, TLE, show widespread brain network alterations beyond the mesiotemporal lobe. Despite the critical role of the cerebrovascular system in maintaining whole brain structure and function, changes in cerebral blood flow, CBF, remain incompletely understood in the disease. Here, we studied whole brain perfusion and vascular network alterations in TLE, and assessed its associations with gray and white matter compromises and various clinical variables. Discussion. Our multimodal findings provide insights into vascular contributions to TLE pathophysiology affecting and extending beyond mesiotemporal structures, and highlight their clinical potential in epilepsy diagnosis. As our work was cross-sectional and based on a single site, it motivates future longitudinal studies to confirm progressive effects, ideally in a multicentric setting. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Effect of corticosteroids on long-term humoral and memory T-cell responses in follow-up visit of hospitalized patients with COVID-19. Background. Corticosteroids have beneficial effects in improving outcomes in hospitalized patients with severe COVID-19 by suppressing excessive immune responses. However, the effect of corticosteroids on the humoral and T-cell responses of survivors of COVID-19 1 year after infection remains uncertain, as it relates to the extent of immediate, antigen-specific defense provided by protective memory. Research question. What is the effect of corticosteroids on long-term humoral and T-cell immune responses? Results. Our findings indicated that corticosteroids do not statistically influence the kinetics or seropositive rate of NAbs against the Wuhan strain of SARS-CoV-2 from 6 months to 1 year. However, subgroup analysis revealed a numerical increase of NAbs titers from 20.0 to 28.2 in categories where long-term, greater than 15 days, and high-dose, greater than 560 mg, corticosteroids were administered. Similarly, corticosteroids showed no significant effect on nucleoprotein and receptor binding domain IIG at 1 year, except for spike protein Ag, beta, 0.08, 95% CI, 0.04 to 0.12, which demonstrated a delayed decline of titers. Regarding T-cell immunity, corticosteroids did not affect the rate or magnitude of T-cell responses significantly. However, functional assessment of memory T-cells revealed higher interferon gamma responses in CD4, beta, 0.61, 95% CI, 0.10 to 1.12, and CD8, beta, 0.63, 95% CI, 0.11 to 1.15, memory T-cells in the corticosteroids group at 1 year. Interpretation. Based on our findings, short-term and low-dose corticosteroid therapy during hospitalization does not appear to have a significant effect on long-term humoral kinetics or the magnitude and rate of memory T-cell responses to SARS-CoV-2 antigens. However, the potential harmful effects of long-term and high-dose corticosteroid use on memory immune responses require further investigation. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Shift-level team familiarity is associated with improved outcomes in mechanically ventilated adults. Rationale: organizing ICU interprofessional teams, nurses, physicians, and respiratory therapists is high priority because of workforce crises, but how often clinicians work together, i.e., interprofessional familiarity, remains unexplored. Objectives: determine if mechanically ventilated patients cared for by teams with greater familiarity have lower mortality, shorter duration of mechanical ventilation, and greater spontaneous breathing trial, SBT, implementation. Methods: using electronic health records from 5 ICUs. 2018 to 2019, we identified the interprofessional team that cared for each mechanically ventilated patient each shift, calculated familiarity, and modeled familiarity exposures separately on ICU mortality, duration of mechanical ventilation, and SBT implementation using encounter-level generalized linear regression models with a log-link, unit-level fixed effects adjusting for co-founders, including severity of illness. Conclusions: interprofessional familiarity was associated with improved outcomes. Assignment models that prioritize familiarity might be a novel solution. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Sodium bicarbonate treatment and clinical outcomes in chronic kidney disease with metabolic acidosis, a meta-analysis sodium bicarbonate for patients with CKD and metabolic acidosis leads to a significant improvement in kidney function. Treatment with sodium bicarbonate increases in mid-arm muscle circumference, indicating a positive effect on enhancing muscle mass. Sodium bicarbonate supplementation is associated with a higher risk of elevated systolic BP, marking a potential side effect. A randomized controlled clinical trial testing effects of lademirsen on kidney function decline in adults with Alport syndrome. Lademirsen, an anti-microRNA 21 therapy, was generally well tolerated in adults with Alport syndrome at risk of rapid disease progression. There were no significant differences between lademirsen-treated and placebo-treated participants in EGFR at any time point. The proportions of participants with prespecified reductions in EGFR at weeks 24 and 48 were not significantly different for lademirsen versus placebo. Here are the articles from Kidney International Reports. Patiramir to reduce albuminuria. Through increased renin-angiotensin-aldosterone system inhibition in patients with CKD, a feasibility trial. Introduction. We tested the feasibility of adding a potassium binder to enable increased renin-angiotensin-aldosterone system inhibition, RASI, and reduce albuminuria in patients with chronic kidney disease, CKD. In a controlled trial design, a potassium binder was introduced exclusively in patients developing hyperkalemia after intensified RASI, thereby mirroring clinical decision-making. Conclusion. Despite extensive screening efforts, few eligible patients were identified, and fewer developed hyperkalemia during run-in. Hence, a trial design limited to CKD patients at high hyperkalemia risk, and including a run-in phase, appears unlikely to provide evidence for a potential renal benefit from additional use of potassium binders.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.